to the State Health Benefit Plan's 2014 Open Enrollment Overview. My name is Ashley Mingwasser, and I'm here to walk you through some important information concerning your open enrollment for the 2015 plan year. In this presentation, we will be covering updates to 2015 benefit offerings, as well as some logistics related to making your selection for the upcoming plan year. Specifically, we will discuss open enrollment dates and responsibilities, changes for 2015, including new vendors, plan options, and enhanced benefits, pharmacy benefits, and wellness benefits. Our annual open enrollment this year is October 27th through November 14th. The website will be up from 12:01 a.m. on October 27th and will close at 5:00 p.m. on November 14th. Members can make their health election at the following website. The Active Plan Decision Guide contains important information about benefit changes for 2015 and outlines the steps members need to take during open enrollment to make their election. This guide is available at SHBP's website. You may go online as many times as you like, but the last confirmed election at the time open enrollment closes will be your election for the 2015 plan year. You should print and keep a copy of your confirmation page, which will include a confirmation number. If you cannot print, be sure to write down your confirmation number. This number is proof of the election you made should there be a discrepancy between State Health Benefit Plan, or SHBP records, and your election. Once open enrollment closes, you may go online to see the election you made and how you answered the surcharge question. It is important that you update your password before open enrollment begins. Your password expires every 45 days. Log in to the SHBP enrollment portal now to set up your new password. If it's been over 45 days since the last time you logged in, you'll be prompted to create a new password. If you do not know your current username or password, click the Forgot User ID or Forgot Password link from the login page. Please read carefully all of the plan documents, including decision guides, SBCs, Summary of Benefits and Coverage, SPDs, Summary Plan Document, and other tools posted on SHBP's website. Confirm that you answered the tobacco surcharge question appropriately. Post-open enrollment, please check and verify that the premium deduction amount is correct. If your address needs to be updated anytime during the year, please notify your benefit coordinator or HR department. For most qualified events, please notify SHBP's Member Services Center within 31 days of the event. Members who do not make an election, either through the web portal or by calling the SHBP Member Services Center, will be defaulted to the HRA option previously selected for 2014 without co-payments. If you are currently paying the tobacco surcharge and you do not make an election, your coverage will default and the surcharge will continue to apply. If you are currently enrolled in the TRICARE supplement in 2014 and you do not make an election, you will be enrolled in TRICARE in 2015. SHBP has expanded its plan options and vendors for the 2015 plan year. In addition to Blue Cross Blue Shield of Georgia, United Healthcare and Kaiser Permanente were selected to provide SHBP members additional choices for 2015. Members can choose one of the following plan options: statewide HMO, offered by Blue Cross Blue Shield of Georgia and United Healthcare; regional HMO, offered by Kaiser Permanente, if eligible; Gold, Silver, or Bronze HRA without co-payments, offered by Blue Cross Blue Shield of Georgia; or High Deductible Health Plan, offered by United Healthcare. Express Scripts will administer pharmacy benefits for Blue Cross Blue Shield and United Healthcare members. Healthways will provide well-being resources and wellness incentive programs for Blue Cross Blue Shield and United Healthcare members. For plan year 2015, SHBP is also providing enhanced benefits for certain covered services. For members diagnosed with autism, SHBP will provide coverage for Applied Behavior Analysis, or ABA, therapy with a maximum benefit of $35,000 per year, up to age 10. The Georgia legislature established a bariatric pilot program to provide benefit coverage for certain bariatric surgical procedures for the treatment and management of obesity. The pilot is limited to 75 non-Medicare Advantage members total. Qualified applicants will be randomly selected by the vendor with whom they enroll. Please contact your selected vendor for more information. For hearing aids, the benefit allowance has increased for children up to age 19 from $1,500 to $3,000 every 5 years. SHBP is continuing to promote health and wellness through the provision of incentive accounts. These accounts will house well-being incentive credits that accompany both statewide HMO, Blue Cross Blue Shield of Georgia and United Healthcare, and HDHP plan options. Credits can be earned by completing certain health actions. These credits can be used to help offset certain healthcare costs, such as co-payments and deductibles. Members who choose the Kaiser Permanente Regional HMO will have various wellness incentive programs to choose from that are administered by Kaiser Permanente. Members who complete certain health actions will be eligible to win an iPad and a Fitbit. Now let's learn more about how the different plan options that are available to you in 2015 will work. An HRA provides first dollar coverage for eligible medical and pharmacy expenses. This account is funded by SHBP. Additional well-being incentive credits can be earned and placed in the HRA account. These credits can help cover expenses for certain covered services and will be used to help meet your deductible and out-of-pocket maximum. Certain drug costs are waived if SHBP is primary and a member actively participates in a disease management program for diabetes, asthma, and/or coronary artery disease. It is important to note that if you do not enroll in an HRA plan option in 2015, any remaining HRA dollars from 2014 are forfeited. Also, if you experience a qualifying event during the plan year that results in a plan option change to an HMO or HDHP, then your HRA dollars will also be forfeited. The HDHP offers in-network and out-of-network benefits and has a low monthly premium. However, you must satisfy a high deductible that applies to all covered medical and pharmacy expenses except preventive care. If you have any dependents, the entire family deductible must be met before benefits are payable for any family member. Also, you may qualify for a health savings account, or HSA, to set aside tax-free dollars to pay for eligible health care expenses. The HDHP plan features are as follows. Plan pays 100% of covered services provided by in-network providers that are properly coded as preventive care. You must meet separate in-network and out-of-network deductibles and out-of-pocket maximums. You pay co-insurance after meeting the entire deductible for covered medical and pharmacy expenses. There are no co-payments. The HSA cannot be combined with a flexible spending account, or FSA. The statewide HMO vendors are Blue Cross Blue Shield of Georgia and United Healthcare. An HMO allows you to receive covered medical services from in-network providers only, except for emergency care. Be sure to verify your current provider is in-network before selecting an HMO plan option. The HMO plan features are as follows. Plan pays 100% of covered services provided by in-network providers that are properly coded as preventive care. Certain services are subject to a deductible and co-insurance. You are not required to obtain referrals to see a specialist, but you are encouraged to select a primary care physician to help coordinate your care. The medical and pharmacy out-of-pocket maximums are combined. Co-payments count toward your out-of-pocket maximum. Certain drug costs are waived if SHBP is primary and you actively participate in one of the disease management programs for diabetes, asthma, and/or coronary artery disease. The Kaiser Permanente Regional HMO plan option is available to SHBP eligible members who live or work in one of the 27 counties within the defined Metro Atlanta service area. These counties are listed on this slide. The Kaiser Permanente plan features are as follows. Plan pays 100% of covered services provided by in-network providers that are properly coded as preventive care. Kaiser Permanente administers the benefits for medical, pharmacy, and wellness. No deductibles. The medical and pharmacy out-of-pocket maximums are combined. Co-payment only option. For Blue Cross Blue Shield of Georgia and United Healthcare elections only, Express Scripts administers the prescription drug pharmacy benefits for members who choose Blue Cross Blue Shield of Georgia and United Healthcare. Express Scripts provides benefits for retail prescription drug products, mail order, home delivery, and specialty pharmacy services. Get up to a 90-day supply of your maintenance medication either through Express Scripts home delivery pharmacy services or at a participating 90-day retail pharmacy. Express Scripts offers several programs for managing your prescriptions. The MyRx Choices Prescription Savings Program lowers out-of-pocket prescription costs. The Worry-Free Fills program offers automatic refills for long-term medications and will be automatically shipped to you. The Extended Payment Program extends home delivery payments over 3 installments. As we highlighted earlier, SHBP is continuing our focus on your well-being. As such, a wellness component will be available with each plan option for the 2015 plan year. Let's take a closer look at how each vendor will be incorporating wellness. First, we'll take a look at wellness in 2015 for those of you that choose to enroll in Blue Cross Blue Shield of Georgia or United Healthcare selections. SHBP will continue to partner with our wellness vendor, Healthways, to provide members who elect Blue Cross Blue Shield of Georgia and United Healthcare with well-being resources and incentive programs. Health actions must be completed between January 15th and December 15th, 2015 in order to earn the well-being incentive credits. Members who elect Blue Cross Blue Shield of Georgia and United Healthcare will have access to a variety of Healthways tools, activities, and services, such as the well-being assessment, well-being incentives, well-being coaching, biometric screenings, and on-site activities. Healthways will also administer 2015 action-based wellness incentives that will allow you to earn credits for offsetting certain healthcare costs. Members can earn up to 480 well-being incentive credits toward medical expenses, plus an additional 480 for a covered spouse, at a total of 960 per household. Members and their covered spouse can each earn an additional 480 well-being incentive credits by completing the following steps. Step 1. The Well-Being Assessment, or WBA, is an online questionnaire. Completing your WBA is required before any additional well-being incentive credits can be earned. Members complete the required biometric screenings either at an SHBP sponsored event or by visiting their physician and having their physician complete the physician screening form. 240 well-being incentive credits can be earned. Step 2. In the next step, the member will choose the path they wish to follow. Telephonic Coaching Pathway, 240 well-being incentive credits, or online coaching. Members will earn 40 well-being incentive credits for each online coaching tracker they use over a 6-month period. The maximum any member or spouse can earn in the coaching pathway is 240 well-being incentive credits. For example, the member completes the online exercise tracker 5 times within 4 consecutive weeks and earns 40 well-being incentive credits. The member then decides to join the telephonic coaching pathway. Once the member completes and actively engages in the telephonic coaching, the member will receive 200 well-being incentive credits because the member has already earned 40 credits from the exercise tracker. The maximum that can be earned is 240 well-being incentive credits. So for 2015, a maximum of 480 well-being incentive credits per employee and covered spouse in total may be earned. That is a family total of 960 well-being incentive credits. Kaiser Permanente also offers wellness resources and programs. Members that elect Kaiser Permanente can access a variety of tools, activities, and services such as the Total Health Assessment, biometric screenings, and healthy living classes. Also, as a part of the Kaiser Permanente Wellness Program, if you sign up at kp.org and complete one of the identified health actions, you will be entered into a monthly drawing for an iPad and a Fitbit to help you manage your health. If you have questions or need additional information, you can call the numbers listed or visit the vendors and/or SHBP's websites. The information provided in this presentation is a summary of changes for the 2015 plan year. It is intended only to highlight principal benefits. Please refer to the Active Decision Guide for more details. Rates, decision guides, and other information will be available at the following websites by October 1st, 2014. This concludes our overview of your 2015 plan year benefits. We look forward to continuing to serve our membership. Thank you.